Hello, welcome to sonography-radiology training channel. This series of video is about the normal X-ray findings simulate disease. This is the second video in this video series about normal pelvic X-ray findings part 2. In this video, we will review 10 cases together. Case 1. In this image, we can see unusually large bilateral fovea cavities which may be mistaken for osteochondritis dissecans. Case 2. Normal asymmetry of the fovea cavities between right and left side. Case 3. Pelvic X-ray in neutral position and in abduction view, we can see simulated destructive lesions of the femoral head produced by superimposition of the acetabular bone on the femoral head. Case 4. The lucent interval between the anterior and posterior lips of the acetabulum may simulate a lucent lesion of the femoral head. Case 5. Bilateral ossification centers for the acetabulum which may simulate fractures of the femoral head in a 14-year-old boy. Most acetabuli or ossia acetabuli are small ossicles adjacent to the acetabular roof regions and may produce an unfused secondary ossification centers of the acetabulum or technological sequelae, for example, acetabular rim fracture or femoroacetabular impingement. Most acetabuli are normally seen in children but typically fuse in mid to late teenagers, being uncommonly seen in adults. In differential diagnosis, in some situations, consider acetabular labral calcification. Case 6, we can see obvious vacuum phenomenon in normal hips of a 6-month-old child, and also another finding accessory ossification center for transverse process of L5 vertebra. Case 7, we can see a lucent line in the femoral head here, but in abduction view we find that it's a vacuum phenomenon in the hips of an adult. Note how the radial lucency in femoral head resembles a fracture line. Case 8, in this pelvic X-ray we can see apparent bulging of the hip capsules suggesting synovitis or hamartosis, but it may produce by filming of the hip in abduction and external rotation as in this 6-year-old boy. In magnification view, we can see obvious normal fat lines on both sides that it indicates there is no any joint effusion or hamartosis. Case 9. Normal variant of femoral heads named plumped femoral heads in a 22-month-old infant. Case 10. Bilateral developmental spurs at the edge of the closed pieces in a 30-year-old man, possible remnants of epiphyseal spurs. Epiphyseal spur or beak refers to a spur in a skeletally mature individual rising at the level of closed epiphyseal line. It may be seen in any epiphysis. At the end of this video, I suggest 2 other of my videos that are close to this video in terms of matter. Thank you for your attention.